By introduction, I'm Gashima Siki, the moderator for today. I work at the African Population and Health Research Center, where I head a department or a unit on chronic disease management. And we are talking about food because food can predispose us to chronic diseases like diabetes, cancers, and heart diseases. Now, this topic is important because every choice you make has consequences. When you make good choices, you live healthy. If the choices are bad, you end up with illness. So today we have eminent speakers. That is Professor Michelle Holdsworth from IRD and her PhD student, Gideon, who is also in the same institute, who will speak about food environments in East Africa. I'll briefly introduce them, but they'll talk more about themselves. Professor Michelle is a professor of public health, nutrition, and a research director at IRD, that is the French National Research Institute for Sustainable Development. And she has collaborated with us since 2017, where we have jointly run projects to inform decisions, government decisions, on how we can eat healthy. She has mentored a number of us. We have established a research program at the center that emerged from the initial work that we did with Professor Michelle right from 2017. And Gideon, as I mentioned earlier, is her student, currently doing work also in food environments. And he has a bachelor's degree in biochemistry and molecular biology and a master of public health with interest in nutrition as well from University of Ghana. I don't want to dilute what you are going to speak. Michelle, you are welcome to speak to the people who are eagerly waiting to hear what you have in store. Thank you.
Thank you very much. Let us go. Sorry, I think we have a bit of a technical issue. So yeah, thank you very much, Gershim. That was a very good introduction. I'd like to thank you for agreeing to participate with us this evening. So without further ado, maybe I'll go ahead and begin rather than continuing to... Oops, I know I have to point here. Okay, so I wanted to start with one slide about what is the IRD. Because I realize that when we mention the IRD, sometimes in Kenya people haven't heard of it. So the IRD is the French National Research Institute for Development. It has over 2,000 employees. About half of those are researchers. The others are technicians and administrative staff. We have one of the 12 IRD representations in Africa based in Kenya. So that's for East African region, of which Paul-André is here. Sorry, I'm not very good at pronouncing your name. Second name, Katalude. He's a representative of East Africa, and then he is joined by some of the other IRD colleagues here. There's other IRD researchers based in Nairobi, as well as the administrative team that supports him that are based at ICRAF. An IRD is a research institution funded by the French government from two departments, the Ministry of Higher Education and Research, and also the Ministry of Foreign Affairs and International Development. And as a consequence, our activities are really around research, collaborations, providing expertise and sharing knowledge and training. Okay. But what we're going to talk to you about tonight is actually food environments, which is a key part of our research activities together with APHRC colleagues. So first of all, we'll talk about what do we mean by food environments and why do they matter. We'll share some of our research findings with you from East Africa about what factors in the food environment influence our food environments. And then lastly, we'll talk about how these insights can help us identify interventions and policies that would actually help improve environments for adolescents. Okay, so first question is really, what do we mean by food environments? Often when we talk about this word, people just really think about the physical food environment. So they imagine that we're just talking about food markets or where we go and buy and purchase our food or eat in restaurants, etc. So that is part of the story, the physical food environment, but also there's other parts. So there's the social environment, which is the interactions that we have with family and friends and how they might encourage us to eat healthily or discourage us to eat healthily. Then we have the macro level environment, which is really like the broad policy environment, and that might include things like national policies for food advertising and other kind of national marketing controls, etc. And within that, we find that the individual is a central part. So the individual interacts with food environments. It's the same for all of us here. The decisions that we make are influenced by our food environment. So we're not always completely free to make food choices as such. So why do they matter? So Gershom touched on this a bit about growing concerns around obesity and diet-related non-communicable diseases like diabetes, heart disease, and some cancers. And what we've seen changing very rapidly within the, I would say, the African context, but globally as well, is this shift from traditional diets that are traditionally associated with living in rural areas that are rich in plant-based foods like beans, pulses, fruit, vegetables, very low or no processed foods, to diets that you can see illustrated by this photograph on the right that are particularly rich in fat, salt, sugar, and processed foods. And the consequences we all know that in the long term that this can relate to those diet-related non-communicable diseases. So what we want to do in many of our studies is understand what is it that's driving adolescents in particularly to consume or be attracted to unhealthy foods. So we're drawing on data from studies that we've conducted with partners in Kenya, and we're led by Gershom, the collaboration on that. Also in Ethiopia, Addis Ababa University, and also in Uganda, in Makara. And what we've done is, the objective of our studies have been collectively to try and understand what are the factors in the food environment that drive consumption of unhealthy food and drinks. And one of the key methods that we've used is what's called photo voice, or participatory photography. And in fact, we learned this method from Liz Kamani, who's sitting over there, who used this method, I think, before to look at child health, but not necessarily nutrition originally. So we learned that method. We incorporated that method into the first research project that we had funded together back in 2016. And so this method is really trying to utilize the photograph as a way of advocating for change within communities. So it's been used across lots of different topic areas. And so we've been probably one of the first to use it in the field of nutrition and food environments. So what we did in our projects is we start where there's capacity strengthening component, which is involving training in the use of photography by participants in the community. So that usually includes things like ethical issues, safety, questions around taking pictures of people's faces, etc. And we ask them to take photographs for usually 1 to 2 weeks on a number of issues. For example, something that makes healthy eating easy, something that makes healthy eating hard, someone who influences what they eat. And then we come back and the photographs are used to facilitate either face-to-face interviews or focus group discussions and to explore the stories behind the photographs. And then what we do as researchers is we look at all the different stories that all these people have told us and see if we can identify common themes that emerge. We've also undertaken photography exhibitions in both Ethiopia and Kenya to take the photographs back to the community, to have a community-based discussion, inviting local leaders so that the voice of the community can also be amplified. So altogether, what the findings I'm going to show you have been selected from interviews and focus groups that we've done with over 300 adolescents in Nairobi, Addis Ababa and Kampala. The target populations vary, but they're mainly in informal settlements and in low to middle class areas. So what did we find? So coming back to the very simple diagram of the food environment, at the individual level, we found many examples of preferences for sweet and foods and fast foods. We found a lack of knowledge of healthy foods and cooking skills, and a lack of money for healthy foods, as well as a lack of time to actually eat healthily. And I'll illustrate these with photographs from our participants. So the first one is around the preferences for sweet foods. So I have some examples here. The one on the top, here we can see that we have biscuits, crisps, we've got waffles, Patco and others. These are foods that teenagers like eating. They eat a lot because they're sweet for enjoyment. And then a girl in Ethiopia saying, most people I know, including me, consume sweets and it's become kind of like an addiction. So this we saw very commonly emerging, as well as preference for fast foods. And those of you who are based in Nairobi will see there's large access to fast foods here, as in many places in the world. As this adolescent said, people of our age love junk food more than healthy foods. Tell me why I would have to cook ugali when I can get chips over the counter. Then an example of a participant talking about lack of knowledge of healthy foods. You find that basic knowledge that an adolescent needs on healthy diets is not there, so they will just go for the easiest source of food, which is fast food. And then we also found evidence of lack of cooking skills. Most of the time adolescents are at home themselves, and since they're not taught how to cook, they will instead go to kiosks, shops or KFC and buy food there. And then lastly, one of the issues that arises a lot is the lack of money to actually buy healthy food, and the impact of that economic status. So we have an example here from a boy in Rwandani. So we eat a lot of junk foods in the slums because you don't have the money to buy healthy food. So you'll just eat junk foods, which is cheaper, sweeter, and can satisfy you. And then I think this is the last one in the individual level. We found there was commonly cited a lack of time to eat healthily that maybe many of us can relate to, besides adolescents. For example, when you are having less time and you want to rush somewhere or do something, you're feeling hungry, you can run to any fast food that you can get and eat. So really that kind of eating on the go, fast foods, and KFC keeps coming up in this, in the participants' narratives. So besides this individual level, then we mentioned the social level was important. And what we found were the key factors were family and the pull towards traditional food that family is associated with, as well as social norms around traditional versus modern foods, finding that adolescents maybe rejecting traditional foods. And then lastly, friends pulling them towards fast food consumption, but also offering social support to them when they don't have enough money. And I'll just give you some examples from the participants. So this is one boy in Nairobi talking about some food his mother's cooked. This is his photograph saying, "This is the food that our parents cook, but I don't like it so much. I prefer other food. It's the food that my mother makes me eat." And we found this similar issue around here. I think this quote summarizes it quite well. You can find someone eating junk food and you ask them why don't they eat vegetables, and they will ask you, are we in the rural area or am I old? They say that it's for older people while it's the teenagers should be eating junk food. So those kind of social norms around traditional versus modern foods, that kind of tension was very present. But we find that friends are also an important influence. I mean, there are some examples of friends being positive influence, but this one, it's some examples where in the presence of friends, there's a tendency to have more unhealthy foods. So an example here, so a friend will pressurize you to go maybe have KFC and fries, so you end up not going to take healthy foods. And secondly, there are adolescents, when they see their friends eating junk foods, they will want to eat that instead of eating healthy foods. So you can see quite a few examples of how friends are influencing food preferences. But we also found that friends offered social support, and particularly economic social support, as illustrated here. This picture is for my friends. You'll find there are times you find you don't have enough money. One of your friends volunteers to buy you food. If another day he doesn't have, then you will also sort him out. So moving on to the physical food environment. So what we found here, two major factors emerge in the unhealthy food availability and how widespread that is, but also the concerns around food safety of street vendors. So I'll just give you a couple of examples. So in terms of unhealthy food availability in the community, we found that people are actually going towards or very limited by what's available in their community sometimes in terms of healthy foods. As this adolescent described, you can go to shop in the community and find things that they sell. They sell only unhealthy foods, and the second shop will also sell unhealthy foods, so you will end up buying unhealthy foods. So you can see that kind of the importance of having available healthy foods in the physical environment would really help facilitate a healthier diet. Then we also found examples within the school setting as well. One participant saying, when it comes to unhealthy eating in schools, it's not out of choice. It's like that. It's all you have because the other options are still junk foods like sodas and cakes. And then the concerns about food safety, which actually is a very common concern also with adults from studies we've done with older participants. This adolescent noting that this place where the trader is selling from is not clean. So what we find that this sometimes pushes adolescents towards consuming processed packaged foods because they think, well, at least I won't get gastroenteritis. Yes, I know it's not nutritious, but they're also looking after their sort of short-term health as well. And then the final level of the food environment is that macro level, and we found two major factors, so around the influence of unhealthy food advertising and also the price of healthy food compared with the price of unhealthy food. So in terms of price, what we see is that there's a lot of concern that healthy foods are more, or perception that healthy foods are more expensive. For example here, had both healthy and unhealthy food been the same price, we would buy cheap food, we would have options. And when you compare the price with real healthy food, most of them prefer fast food because it's cheaper. And one last example here is around the consumption of fruit and vegetables. Compared to healthy food, junk food is very cheap because you find that some fruits from the local food vendors are more expensive. And then the final issue that arose was around the advertising of unhealthy foods. This example here is the community, especially in the surrounding area. You'll find adverts that show you foods like KFC and Pizza Inn and you feel like you cannot miss out on them. It's a major enticement. And we saw several examples of this in our studies. But besides that kind of physical environment in the street, we also see examples. I'm sure all of you get adverts on social media about food. And this is an example from a participant in Addis saying, I see many unhealthy food advertisements and promotions for social media and national TV. Food advertised includes chips, junk foods, sugar-sweetened drinks. They're highly advertised and I can easily access them. In fact, she went on to say you can just get them delivered immediately. You click on it and it's delivered to your home very quickly on a boda boda, okay, equivalent. I don't know what it's called in Ethiopia. Boda boda. Yes, I know we have one. So what we wanted to do is to see how these findings could help us think about what interventions and policies would help address them. And that's something that we've been working on with colleagues at APHRC for a number of years, is looking at solutions. But first of all, we need to look at the causes of the problem, which is what I've just described. I've summarized here the key factors, but on each level that we identified, but I'll just identify some potential interventions that could address these. So on the individual level, we had a lot of preference for sweet and foods and fast foods, a lack of knowledge, lack of money, lack of time. So some of the ways that we could address these is obviously around education, but education around affordable, tasty, healthy foods. So trying to make healthy foods appealing. And I think it's around kind of trying to create that demand for healthy food and drink. We also find maybe cooking skills classes, as well as food and cash transfers, which are actually to help supplement income as well. Could be an important intervention for social protection. On the social level, what we found is that interventions that also don't just target adolescents, but also involve their friends, their families, seen how important they are in influencing them, that they actually would strengthen and amplify those messages, and also try to address those norms around traditional versus fast food, to try to promote a positive image of some of the traditional dishes in each of the countries. On the physical environment, as I mentioned, widespread availability of unhealthy foods and food issues around food safety. So it's very important to engage food vendors, training them in food safety and nutrition. I know this is something that Dr. Liz Kimani has been involved in a number of projects, including in Kisumu. And also looking around restructuring urban food environments to make them safer, but also healthier in terms of nutrition. And then lastly, on the macro level, concerns around food advertising and food pricing require regulations, so solutions that are at that higher level that require support from government and other actors. So that might be subsidies to make fruit and vegetables cheaper, or taxes to make unhealthy foods like sugar-sweetened beverages more expensive, to discourage consumption. And also it might be to introduce food advertising controls at that level as well. It requires government support. So I'll finish here. So thank you very much. What are we doing for time?
Thank you very much for a great presentation. We've really enjoyed. And I think you made it very simple. We understood the whole thing. There will be a time for questions. But at this moment, I want to welcome the Director of Alliance Francaise to speak to us first before we proceed. We have occupied your territory, so we'd like you to officially welcome us before we proceed. Thank you.
Okay, thank you. Well, you have been distributed some healthy food, so please eat it. Well, it looks like very odd to organize a conference about adolescents and healthy food for adults, and offer you only samosa and fried things, you know. So, well, it's a bit different from our custom buffet, but we still have wine. So, but just after the conference. But before, I would like to thank, obviously, all these researchers, because it's very interesting to see that this question is worldwide. This other question, these questions are the same in France. We have a lot of obese adolescents. So, well, we have the same problem and with different environment, obviously, but it's a worldwide problem and a health problem important. Donc, je ne sais pas s'il y a des questions. Is there some question? And I will give the mic back to...
Thank you so much. Our next presenter is Gideon, who will talk to us about what solutions have been proposed by various stakeholders, and particularly the adolescents in Kenya. Thank you, and Ghana.
Right. Thank you so much. Okay, so whilst we wait for my slides to be shown, so this section is just going to focus on what I refer to as our baby steps, trying to address some of the barriers that Michelle presented as preventing adolescents from eating healthy. And it's actually part of a bigger project. So I'm going to be presenting to you that bigger project and the activities that we are currently undertaking to address some of these steps. It's coming. All right, good. So what I refer to as, I'm referring to as the baby step, is a project that is currently titled the Generation H project. And this project is actually an EU-funded project, and it's a project that is currently being implemented by a consortium of about 7 different institutions, including IRD and APHRC. And these projects actually aim to develop an intervention, what we call a multi-component intervention, to address the issue of unhealthy diets, and not just unhealthy diets, but also physical inactivity among adolescents in urban sub-Saharan Africa. But for the sake of this presentation, I'm just going to focus mainly on the unhealthy diet components. So a bit of a background. So we all know currently non-communicable diseases, or sometimes referred to as chronic diseases, is currently on the rise, and there have been a lot of contributing risk factors, and some of these are behavioral in nature. So you could think about unhealthy consumption of food, being physically inactive, smoking, unhealthy consumption of alcohol. All these are factors that have been shown to contribute to non-communicable diseases. And there have been attempts to address this disease or condition. But what we've realized is that most of the time, this attempt is focused towards adults. But there again, we all know that all these behavioral risk factors are factors that are actually developed from adolescents. So it's better to try and intervene during the adolescent stage so that you can help inform when they are adults. And again, there are interventions, but what we've also realized is that most of these interventions that are currently available are interventions that have been developed mostly from high-income countries. And the setting is different from what we have in Africa. So there's a need to develop interventions that are very context-specific so that they'll be able to respond to the risk factors that Michelle presented to you. So the Generation 8 project, our overall objective is to co-design and evaluate interventions to reduce this unhealthy diet and physical inactivity among adolescents in Ghana and Kenya. So in Kenya, we have 2 study sites, one within a high socioeconomic status location, so we are looking at Burumburu, and also one in a low socioeconomic status, Kibra. And like you've seen from the title, our target population is adolescents within the range of 10 to 19. And we hope that when our intervention is developed, we are going to be implementing this through schools and also faith-based organizations like churches, mosques, and churches and mosques. So, what did we do? I'm just going to be presenting like a brief of what we did on the Generation 8 project. So, we did 3 main activities currently. The first is to conduct an evidence review to understand currently in Africa or Sub-Saharan Africa, what are the interventions that are currently being implemented, how do they work, and for whom are they working for. We also consulted stakeholders to also understand the context, just something similar to what Michelle presented, to also understand what is actually influencing adolescents' diet and physical activity behavior, and also to have insights in what are the current interventions that is currently going on and how are they working out. And then with that understanding, we engage stakeholders, including the target population, which is adolescents, to now co-design an intervention to help address this problem. So this is just a picture trying to depict some of the activities that we undertook with the stakeholders. So we had meetings with stakeholders, including the parents, adolescents, government actors, teachers, and other health service providers, to brainstorm and come up with ideas that can help us improve on healthy diets, improve the dietary behavior of adolescents as well as their physical activity behavior. So you could see some of the stakeholders during the workshop sections where they brainstorm and then come back to provide possible solutions that we can use to address some of these issues. So not to waste much time here, what we found is not so different from what Michelle presented. When we engage stakeholders to, especially adolescents, to find out from them what are actually the barriers to you, what are some of the barriers preventing you from eating healthy foods. We found out that all the barriers, like Michelle presented, is spread out across all the levels of the food environment. So issues at the individual level, like Michelle presented, the financial constraints, time constraints, they not having the knowledge about what is a healthy diet or unhealthy diet, as well as their personal preference for unhealthy food. And within the physical environment, we also find out that not just that there's not availability of healthy food, there's also the issue of lots of unhealthy food within the physical environment. And then in the social environment, we found out that the habit of their friends as well as the habit of their parents or the kind of practices that they take in their house also have influence on their food choices. And at the macro level again, the issue about the cost of healthy food came up, and also food adverts also came up. So based on our findings and the insight that we got from the evidence synthesis, the stakeholder consultation, and the co-design workshop that we organized, we came up with what we call the intervention component. And this intervention component is trying to address some of these factors that were presented earlier on. So if you could remember, there was issues to do with knowledge, there were issues to do with the food environment, as in the physical environment, there were issues to do with the social food environment regarding their peers and their parents. So we have this currently as a Generation H intervention component. And this component, we have what we refer to as 3 main components. And by the 3 main components, I'm referring to the inner circle. So there's going to be part of the Generation H intervention where we are going to be providing education to these adolescents to raise their capacity in terms of their knowledge about healthy and unhealthy diet, as well as provide them with the needed skills to be able to eat healthy. There were issues that came up to do with the adolescents not being able to prepare healthy food or not even able to prepare food. So during this component, the education and awareness component, will try to address that issue about the knowledge and the lack of capacity. There's also going to be another component that is going to now deal with the physical food environment, where we saw that Lucien talking about currently they're not having enough healthy food within their space. So the Generation H project is going to aim to also address that by introducing healthy food options. And in this case, we are focusing on fruits, vegetable, and water, clean water. I'm not going to talk about the physical activity component, but then to support this education provision and the modification of the physical environment, we have what we refer to as 3 other supporting components that we believe needs to also be in place to make this core intervention component work. We are looking at leveraging on peer influence. We realize that a lot of the time, whatever that their peers do, that also influences what they do. So we are going to, again, leverage on their peers to also promote the habit of healthy diet consumption. So that's what we have at the top there, saying leveraging peer and social influence. We also realize that parents in the community also have a stake in the kind of food habits that these adolescents have. So we are going to be engaging parents and as well as other community members to spread the message or reinforce whatever will be educating these adolescents on. And we are going to be doing that by also providing more like a sensitization to these parents, letting them know the benefit of healthy diets and why their kids or adolescents need to eat healthy diet. So we are going to be engaging parents as well. And the last but not the least supporting component is making sure that whatever we are promoting to these adolescents is embedded within their setting. So for example, most of the time you find out that we ask adolescents or people to eat healthy food, eat fruits and vegetables, but then we are promoting fruits and vegetables that are not even within their settings. So you ask somebody to eat broccoli and they may not even have it within their setting. There are other available cultural, available fruits or vegetables that are within their setting that equally will work like the broccoli that you are asking the person to do. So we're going to make sure that our intervention incorporates some of this cultural relevance to help the adolescent to accept what we are asking them to do. So that is complex, having core component, but like I said, having other supporting components. So I mentioned earlier that to be able to do this, we didn't want it to be like we researchers being in our offices and designing an intervention for this adolescent or their parents as well as other implementers. So what we did was to bring them together and have them to now design something that they think will work for them. And out of that process, for the education components that I mentioned earlier, the adolescents and the other stakeholders felt it would be good to have structured sections, peer-to-peer structured sections, and have one of their own lead this education section. And also, to complement that, it would be good to also have our education captured on other formats like using posters, as well as generating videos to contain some of this education that will be given to them. Because most of them found themselves mostly on digital media, social media. So some of these videos or outputs can be then be shared on those platforms. And then to also engage or provide the same knowledge that we want this adolescent to have, we'll be conducting community events where during those events we'll be capturing or we'll be focusing on the parents, where they'll also be getting the education on healthy diets as well. To help improve the food environment, in this case I'm referring to the physical food environment, within the schools and faith-based organizations, the plan is to partner with food vendors within the school, and then with these food vendors we are going to introduce the options of fruit, vegetable, and clean water, so that the adolescents can then be able to have access to these options. So not just give them education, but also creating the enabling environment for them to be able to use the education that they'll be getting. we have, like I mentioned, another component on physical environment, but as that's in the focus of today's talk, I'm not going to go into that. So our next steps, we have the design for each of the components ready, but what we need to do now is to now develop the intervention materials that will be using for the education component. So if there's going to be a peer-to-peer section, definitely there needs to be lesson plans that needs to be used to facilitate that session. If there need to be a poster, we need to develop posters that will now contain this information that we want to give to the adolescent. So currently what we are doing now is developing these draft materials. And the next thing is now to go back again to these adolescents and consult with them to get their feedback, whether the materials that we've drafted is actually responding to what they deserve or what they think can help improve their dietary behavior. And then when that is done, we will now start the implementation in the schools and the FBOs that are going to serve as the implementation setting for this project. And we hope that when everything is done, sometime next year in June, we will start with the implementation of the actual intervention in the school. So this is more like our baby steps, dwelling on the evidence that we got from the adolescent as to what's serving as barriers to them not eating healthy. And we hope when we implement the components of our intervention, we are going to help address some of these barriers. Okay, so I'm going to stop here. Thank you.
Yeah, thank you very much, Gideon. You're a typical candidate, a PhD student of Professor Michelle. She must be very proud of you, and really thanks very much for making it easy. The message we get from the two presentations is that we want to make healthy food the easier choice. What is happening now is there's abundance of unhealthy food. And we're actually worried about foods high in salt, sugar, and fat. And most of these are actually highly processed foods that are marketed and sold in supermarkets, kiosks, and shops. So globally, it was estimated that in 2019, 11 million people died worldwide because of unhealthy eating. What that means is food choices is an important topic, and you're lucky today to have listened from research done locally here. And our hope is that you'll carry this message to your homes, to your peers, to improve. We don't have to wait actually for policies. We can start by changing. And I'm glad that our host has demonstrated by supplying us only healthier options. And for your information, wine is good. A bit of wine is good for your heart. So I'll now open the session for questions. If you have any questions or comments that you'd like to make, Gideon and Michelle are available to respond to all your questions. But in the interest of time, we shall try to limit that to not more than 15 minutes, because we want to have time for other things. Yes, yeah. The guy in the cape. You can introduce yourself.
Okay.
Yeah.
Okay, thank you very much for your good presentation. My name is Mark Ambitho. I'm also a researcher, a lead researcher with Infotrack Research and Consulting Company. Most cases people know us in the political field, but we also do other forms of research. Now, coming to my question. First, I find a lot of disconnected factors trying to solve this issue. I know that USAID is trying to advertise. If you check on television every day, there's this advertisement of Food Fiti, where they're trying to promote the indigenous vegetables. They also are trying to reach the masses to try to show them the importance of this kind of taking this nice food. But my question is, from a young age, basically, as for myself, we develop this kind of behavior because from a very young age, you find that when you cry, your mother will buy for you sweets, you'll be bought biscuits, you'll be bought a soda, and most likely you can also be bought chips, sausages, and this starts at a very young age. So you adapt it, and when the time comes that you reach adolescence, it's already formed into your mind. Second, if you look at what they said KFC, if you look at the multinationals, Coca-Cola, KFC, the ones who are dealing with this kind of food, they have a lot of muscles for the advertising, and all the advertisement they put in the television, they appeal to the young generation. If you look at the outlets, they're also sparky. Most people, when they want to go out, they prefer to go to this kind of places better than the other normal kiosks that put our own traditional food. So, mine was just to ask, why didn't you start from where the rain started beating us? From that age, when that boy is still young, maybe from the time he joins class 1. Because I think if he had some literature from that early age, then it will stick on our mind. But from that time of adolescence, it's already stuck. So you find that we already have this kind of, we are used to chocolates, we are used to all those kind of things, biscuits, sodas, and things like that. That's my question.
Thank you. Another question? Yes.
Thank you. The question I wanted to ask, gentlemen has already asked, why it took so long for us to come here and discuss the matter. It's quite serious. We should have done it that before. And number 2, I've done my research also. Why not healthy food and easy fast food? It is brainwashing, tempting, and attracting also. They say, you see this kiosk, they are selling the food. We call it African diet, which is very nutritious, healthy. But for those obstacles, they say, just leave it. They don't wash their hand. Look at the way the cutlery is, the way they buy easy food, and off we go. Another thing, it used to be termed, this healthy food used to be termed as poor man's diet. Go for the healthy and luxurious food. So my question is, how shall we adapt, implement, and it is not easy, healthy food to be packed the way it is packed in the supermarket, crisps, etc., and fast food, buy chips and off you go. So what will be the bottom line solution for attaining, because you know Nairobi is a hustler city. You don't have time even to go for short pee. Yeah, time is limited. So everybody off they go, eat and go. They want to attend for duty, time checking is there when you're employed. So how shall we find the ways in regard to the having exercising equipment, etc.? Surely, honestly, I do it naturally. Yeah, I walk fast, I climb stairs, come up and down. When you don't, when your pockets have been ironed, you know what I mean? You don't have that. So how will you afford to go to gym or have those physical exercise equipments, etc., etc.? So we have to find a bottom line solution, or continuous sessions like this, yeah, community gathering, attracting people, and this is the way forward to have a healthy diet, not only for Nairobi, Kenya, region, continent, but the world. Western countries are suffering more than we are. I've done research, I've seen the way it, fast food, etc., etc. Very, very nutritious, not nutritious, very tasty, but not nutritious. Don't give us. So what will be the bottom line solution? We get together in a unified way, whole world have a diet that is healthy. Thank you.
Thank you very much. I'll take one more question, then they respond, then we take another set.
Okay, thank you so much. My name is Alice Rito. I work as a research officer at APHLC, and kudos on the good job, obviously. So I just had a question specific to the interventions. I can see we are focusing on schools, and we are also targeting parents and community members. But from our engagements, especially in the low-income settlements, there's a particular group of adolescents that are not often visible. So when we are engaging with them, they are called child-headed households. So these are adolescents who are in charge of full households, making all the decisions on nutrition. They do not have an adult who supervises them with that. And sometimes they don't even attend school because they have to get the income and, try and buy these healthy foods. So yes, some can be met at the school level, and these interventions will benefit them. But how can we include even these other adolescents who still need to make decisions, not just for themselves, but also for entire households like siblings, and maybe sick parents and such. So just that invisible, vulnerable population right there. Thank you.
Thank you. So let me now turn to you to respond to the questions. It's up to you to decide who responds to which one. I hope you remember them.
Yes, and I think
If you don't, I can repeat
I
some
think
of
this one
them.
is so fresh in my mind. The last question. So I don't know whether maybe I missed it, but in my presentation, I mentioned that aside schools, we are hoping to reach those that are out of schools through other institutions like faith-based organizations, because we believe, and even from the literature, realize that within this setting, a lot of people have one faith or the other, and if they are not in schools, we can reach these adolescents through the faith-based organization. So that's one potential setting that we are hoping to leverage on that. But then also to add up to that, during our co-production sessions, there were other avenues that came up that the stakeholders thought we could add to the faith-based organizations. So we are exploring that. So we hope that that group of adolescents that you just mentioned, we could reach them through those other settings.
That's one of the things that made our project unique to the EU, the fact that we are targeting adolescents out of school as well, through community-based faith organizations. Yeah, great. Any?
Yeah.
Yes, the response.
Yeah, obviously, Alice,
Yes.
a very challenging question, I think. And maybe some of those kind of policy interventions, social support, financial support through cash transfers and things like that could be considered for context like the one you just described. Just coming to the first person who's talking about why are we looking at older adolescents? Is it already too late at the age of 10? It's a really interesting point because a lot of research has focused on interventions in primary school children and younger children. It's actually a missing or under-researched area is the kind of secondary school adolescents and also up to the age of 19. Obviously, you've got people going through quite a lot of different life stages. Sometimes go working, becoming parents, etc. So I think for us, and the NCD risks that it became more important to focus on adolescents because of that. But in fact, I know there's other projects, APHRC, focusing on primary school children and also children under 5 as well.
Correct. Adolescents are just one of the populations of interest. We are doing many other studies in younger children, but also behavior formation tends to happen a lot from adolescents. That's when they start experiencing independence. That's when they can buy things on their own. Parents give them money. Most times the younger children are controlled by their parents. Decision making is a lot with the parents. So interventions at that level tend to focus more on educating the parents. And I think in our study, we are also focusing on the parents. And through that, that can also influence the younger children. There was one more question from him about why not package the healthier foods like the fast foods? That's a nice question. I think we have talked about this before in other sessions.
Yeah, so and that's very interesting because I was just reflecting when you asked the question. When we were doing the co-production and we were just talking about how to make healthy food available, I think one of the things that keep coming up was how can we make this healthy food attractive to these adolescents? And then what came up was that whilst we are trying to promote the availability of healthy food, why don't we use some nudging strategies to encourage the uptake of this food? So, for example, when we go to schools and we introduce fruits, we should have strategies of presenting these fruits that is going to influence their uptake. So you go to a school and you have watermelon. We are hoping that we are not just going to give the students or the adolescents watermelon, but we are going to cut it into appealing shapes, use prompts within these schools to also influence their uptake. So that's one strategy that we are going to use to not just provide fruits or vegetables to these adolescents, but also promote its uptake by using like the appealing presentation, using prompts, advertising these fruits within the school that in your canteen you have delicious mango slice. Why don't you check it out? And we hope some of these strategies can also help promote this healthy food option, just like these unhealthy food companies are using adverts to also promote their unhealthy food. So that's some of the strategies we hope could also work in the promotion of these fruits and vegetables.
Yes.
Because most healthy food are perishables. Yeah? You cannot carry a watermelon and start slicing to school. They hardly got 30 minutes break time when I was schooling. So they have to go to nature's call, etc., etc. So why don't we come with an idea? We have what we call roasted or dried fruit, yeah, dried meat. It can last, and said it has perishables have got shelf life. You see, so we know the demand will be, and it is said, and if you and I are hungry enough, we'll chill into it anything. There's a movie I watched. He ate even a cockroach when he was hungry.
Thank you very much for those insights. I think these are very excellent ideas. I need to meet you and we start our own business of selling healthy food. One thing I wanted to tell you is that actually the food industry is very powerful. They can advertise, they can offer price promotions because they have the money to do that. Can you work with the food industry to also promote the healthier options? I think those are some of the questions probably we should be asking. But closely to what he also raised, the first question, this is a macro problem. Some of these macro problems are best addressed by the government by putting in place policies that restrict marketing of unhealthy foods, putting in place policies which encourage the production of healthier foods, like offering subsidies to farmers and transportation and even refrigeration facilities. I know that there's a school feeding program going on in this country. To what extent do we supply healthier options in the school feeding program? Then some of the policies at macro level include things like taxing unhealthy foods highly, then cutting the taxes on the healthier ones. In the end, the prices of the unhealthy foods will go up, because actually what is happening now is the poor people are saying we can't afford the vegetables and fruits in the supermarket, but we can afford the fast foods. So when you increase taxes on the unhealthier options and decrease taxes on the healthier ones, we will have better choices. So restrict choice by making the buying of unhealthy foods uncomfortable, by increasing the prices. Those are some of the avenues. And we are now working with the Ministry of Health actually to produce 4 policies. They have been drafted, they are going to Parliament soon. The first policy is actually increasing taxes on the unhealthy foods and reducing taxes on the healthier ones. The second policy is labeling the foods in the supermarkets with simple graphics such that consumers can quickly tell this food is unhealthy or unhealthy. For those who are from high-income countries, you must have seen those labels, traffic warning label systems and so forth. Then we have procurement of healthy foods in institutions like schools, hospitals. We want to see that the policies that are in place promote healthier food procurement. The last policy we're looking at is how do you restrict advertising of unhealthy foods? Because we have done studies in 500 schools in Kenya, Baringo, Nairobi, Mombasa. It has shown that advertising is even happening around the schools. It's happening on TVs during peak hours when children watch TV. It's also happening on social media. So if you have laws in place which restrict too much marketing of those unhealthy foods, then you can also reduce consumption. But I really like your point. As we try to reduce the unhealthy ones, can we increase the advertising of the healthier options? I'm opening up for more questions, if there are burning questions. Yes, can the mic go there? Start with, yeah, this is the last round.
Huh?
So, I saw 2 hands up. Take the mic to that.
I want to.
Oh, you're asking. I thought you were holding the mic for something. Go ahead, please. Yeah.
Okay, thank you. My name is Abubakar Bakari. I studied food science and technology at the University of Nairobi. So the topic of discussion today is something that's really related to my field. And mine isn't really a question, but more of a comment, just to add on what he said and what you've just said about advertising of these unhealthy foods. For example, let's put ourselves in the mind of these adolescents, or for example, in the mind of a 10-year-old, looking at an advertisement for KFC, for example. Most of the time, the people in that advertisement, they're looking very, very happy, they look like they're enjoying themselves. And it sells the idea to the children, the adolescents, that when they also have this KFC or those unhealthy foods, they will also be happy, like the people in the advertisement. And an example I can give is, for example, when Coca-Cola first came out, it was being sold as something that has this multitude of benefits to the body, and it made people really increase their uptake of Coca-Cola, but it was later found out that it wasn't the case, and policies were put in place to reduce the advertising, to tell people the truth, and I believe there has been a corresponding change in the consumption of Coca-Cola as of today. And another thing which I might talk about, although not necessarily a food product, but I believe the aggressive campaign against it has really led to a huge reduction in the consumption of the product, is cigarettes. I'm sure you get even, I don't know, 7-year-old, 8-year-old kid, maybe some have never even seen a cigarette, but they will tell you that cigarettes are bad. So if we can, for example, launch a campaign like that one, I don't know how, to kind of educate them on the dangers of consuming these unhealthy foods, I believe it will be a huge step towards, moving towards the healthier foods and leaving the unhealthier ones, and they will have the benefits for life.
Thank you. I think those are comments. We don't have to respond. Thank you very much for those comments. Next.
Thank you so much. My name is Shatu Gurma from the African Population and Health Research Center. So my question is, have you assessed the risk perception related to unhealthy food? Because when you are young, you take all the risks. You undermine your risk. So how is the perceived susceptibility to the outcomes of unhealthy food consumption and the perceived severity of consuming these unhealthy foods among young people? Because, you know, when you are young, even at this time, you don't feel that you will die one day, yes? Every day you will not be conscious. If we are conscious like every one of us, I mean, most people are not religious because one thing, maybe they don't believe that there is life after death, yes? Or they don't believe that there is God. Or though they believe that there is God, they assume that they will not die soon. Yes? So the same thing is true in sometimes the unhealthy food issue. So have you assessed that element? The second question is, how is our communication among the scientists and the media people? Yes, how are we going communicating? Like drinking coffee, is it protective or a risk factor for cardiac problems? We don't know. It's a conflicting information, evidence is there, and the journalists, the media people, how they are communicating, they sometimes they can present a person who lived for 110 years, and they ask this old guy, what is the secret of living for long? Okay, they say they can say like, I usually eat meat, milk, and I only consume some issue. So this evidence by itself can be very powerful than our like I mean complex statistics sometimes.
Okay.
So how is the communication? Have you seen that among health providers,
I got the point.
scientists, communication?
Yes, wind up there. Thank you very much. Last question, because we're closing. Yeah. Last question. First of all, that Liz, maybe you come last. This person's hand has been.
We're not a lot of people. I suggest we continue this discussion between ourselves.
Yes,
and
actually
with
at cocktail,
a nice
yes.
glass of wine.
Yeah.
And okay, so you can talk to the people that you're not going away.
Correct.
You're staying. So yeah.
Yes.
Just come on.
Actually,
Okay.
the questions will continue during the cocktail.
Thank you.
So I think we should wind up. And do you want to comment on the questions raised so far?
From Eshetu?
Yeah, from Eshetu.
Well, maybe just to say, no, we didn't assess risk perception. That's the answer to the first question. Your second question was, what was the second?
It was about communication by the media regarding risk, scientific evidence versus simple communication.
Okay, I suppose for the scientific evidence for us, because in Generation H project we're focusing on promoting fruit and vegetables, water. There's not really that much debate or ambiguity about the fact that they are healthy, and also promoting the reduction of sugar-sweetened beverages, and equally that's not much ambiguity about the fact that that's not good for you. So we have those kind of grey areas that you talked about. I think we've avoided them in our decisions. Yeah. Thank you.
Great. Thank you very much. I'm going to close this now. I want to thank you all for the great presentations and their reactions to the questions, and also the audience here for being a nice audience. We have enjoyed your silence and questions, and I hope we have learned something from here that can inform future interventions. I also want to take this opportunity to thank our host for being a nice host. Apart from providing very nice environment for this conversation, she has given us healthy food and some wine. Thank you.